Hello and welcome back to my channel, Empowering Aesthetic Excellence. I'm Dr. Bhavna Agarwal, facial aesthetic consultant, aesthetic physician, and a beauty psychologist. Now, this is the third video that we are doing in the series, Eyes and the Peri-Orbital Rejuvenation. And in this video, I'm going to be discussing the various assessment parameters or the things to look at or the aspects to consider whenever you're planning any aesthetic procedure, be it Botox or fillers or thread lift for the periorbital area. So without any delay, let's get started. So the most important thing about the assessment of the area in the periorbital region, or for that matter, any aesthetic concern on the face, is that the face is not only not a static unit, but a dynamic unit. So while the concern might be static, it might be visible or it might be bothering at a rest, but the implementations or implications or the outcomes will have to be dealt with the dynamic aspect of it. So a static assessment as well as dynamic assessment is always advisable for any aesthetic concern for face, especially the periorbital area. So the next thing, the first thing that you have to observe is first the position and the arch, how the eyebrows are placed on the face. And we've discussed in the previous videos that there's a gender variation, that in women, the eyebrows sit slightly above the orbital rim, whereas in men, it is overlying it. And in women, it follows a natural arch, which peaks at the medial 1/3 and lateral 2/3. And in men, it is more or less flat. Now, the other important thing is it frames the eye. The eyebrows frames the eye. But that means that the entire expanse from the medial canthus to the lateral canthus, the eyebrows do cover the entire expanse of the eyes. And the next thing is that it gives a pleasant contour to the eye. So this is the first thing that you observe. The next thing, which is very important, is symmetry. Now, symmetrically placed brows they can contribute to facial balance and attractiveness. But the most important thing about symmetry is that slight degree of asymmetry is always there in faces, in the right and left half of the faces. But we are not able to acknowledge that because we are so used to seeing ourselves the way we are. But the first time people acknowledge these asymmetries are after any aesthetic procedure done, because that is a time when a lot of factors are coming into play. So usually asymmetry becomes more obvious with various factors like aging or behavioral patterns, like the side to which you sleep or the side which you use to chew most often. So these can contribute, and there's other reasons like genetics, trauma, medical conditions, gravity, overplucking, overwaxing, and other aesthetic procedures which can contribute to the asymmetry. But the most important cause of eyebrow asymmetry in healthy individuals is excessive muscle dynamics on one side, which means that we all know that one side of our body is the muscular strength is more as compared to the opposite side. And similarly with the face also, like one side has muscle strength more dominant as compared to the opposite side or the other side. And because of which one side of the face is usually more involved in evoking any kind of movement on the face. But when you do a procedure like Botox or fillers, which have been equally injected on both the sides, so the dominant side tends to produce a stronger movement of the muscle, which can lead to this disparity in the eyebrows. So I get a lot of individuals who, after getting Botox done, notice this asymmetry, especially when they are raising, or especially when they are performing any expression or emoting, when they're raising their brows. That is because one side of the face has more muscular strength and Botox has worked equally on both sides. But because of the difference in the muscle strength, the one eyebrow is going more higher as compared to the other. So the muscles which are causing this asymmetry due to hyperkinesia are frontalis and depressor supercilii. So these disparity might not be acknowledgeable before the treatment, but it is definitely a thing to consider if after the treatment, even after injecting the equal amounts on both sides, there is slight asymmetry. The important thing about asymmetry due to hyperkinesia is that at rest, there is no asymmetry. Because if the asymmetry after the procedure is present at rest, that means it is because of the product. But if it is at rest, there is no asymmetry after the procedure. But when you raise the eyebrows, or when you bring, or you frown, then at that time, if there is asymmetry, then it is because of the excessive muscle dynamics. The next important thing is proportion to the facial features. The size, the length, and the thickness of the brows, they are all proportional to the individual facial structure. So sometimes the brows are too thin. You have big eyes and very thin eyebrows, so which are again a disproportionate look, which now might not be aesthetically pleasing. And if you have fine features but very thick brows, that also creates a aesthetic disparity. So that one has to observe. Now, there is a natural tapering to the brow. That means towards the tail end, it doesn't end abruptly, but there is a gradual taper down. So because of this natural tapering, it creates a soft and more refined appearance of the eyebrow. Sometimes this natural tapering is absent in case there is a loss of lateral brow hair, which is very common as aging also, and in some medical conditions also. The distance from the eyes, this has been discussed in previous videos, that the distance from the eyes, it is should be proportionate, framing the eyes without encroaching too much or without appearing too distant from them. The density of the hair in the brows, that it could be globally sparse or it could be laterally sparse. So if there is the density of the hair is less, then certain procedures like microblading have to be considered before getting Botox or any other filler done, because before going in for brow lifting, the brow has to appear, the density of the hair has to be normal. Now, there are certain functional aspects, because face is a dynamic unit, as I discussed. So there are certain functional aspects to it also. So the expression and the emotion aspect of the face, that is, a well-shaped eyebrows contribute to various expressions and emotions. They enhance the non-verbal communications and the expressiveness of the face. So you observe the face at the resting phase, in the resting position. It could be the expression of the face, and in the resting position could be anywhere between from sad to angry to tired to surprised. All these looks have been contributed. The eyebrows have some or little contribution towards all of these looks. Next, besides framing the eyes, the eyebrows also frame the face. And properly shaped and positioned brows, they will act as frame for the eyes and face, and they enhance the overall facial aesthetics and the symmetry. Now, the various facial shapes are there, and for each facial shape, there is an eyebrow solution. That is the shape of the eyebrows. So this is a topic for another video, but for now, this is a gist, and if you want, you can take a screenshot of it. The shape of the brow for a particular facial shape, for it to look more longer. For the face to look more longer is given here. And another important aspect of eyebrows is that they have a gentle arch and position slightly higher on the face, and this gives a youthful appearance. So when you see eyebrows in teenagers, they are give a very raw look or very unrefined look. Whereas as in a youthful eyebrows, the look is very refined and arched and well positioned. So, and as you gradually age into the senior years, then the brow becomes flat, sparse. And so this is how the eyebrow changes over the years. Now, aesthetics of the normal brow, it can vary among individuals. There could be cultural preferences, it is a facial structure maybe, or there can be personal preferences, or there could be media-driven taboos which one wants to follow. So these are the various parameters that you have to observe and describe, and then plan your treatments accordingly, keeping all these aspects in consideration. Also, they say that the most important aspect of any aesthetic procedure is not the procedure, is not the technique, but the treatment planning itself. And best treatment plans can be achieved only if you gain maximum insights through the pre-treatment assessment and analysis. And these are all the factors which can help you identify the various aspects of the eyebrows. So thank you for watching. Hope this video has helped. Do share your thoughts, suggestions, and questions. The next video is going to be the brow lifting techniques or the peri-orbital eyebrow rejuvenation with Botox. That is mostly the brow lifting techniques with Botox. So thank you for watching and bye until next time.